Hey everyone, it's Mary Dwasi here, CEO and founder of Mary D Wellness Coaching, your virtual midwife and your overall wellness coach for busy moms with combined nursing and midwifery over 15 years experience in the field. So it's November Prematurity Awareness Month. So preterm birth basically is defined as any birth of a baby before 37 weeks of gestation. And it occurs for various reasons. In the UK, it is a significant public health issue with around 8 to 10% of babies that are born prematurely every year. So the common causes of premature birth: multiple pregnancies. Women who are carrying twins, triplets, or more are at higher risk of premature birth, with over 50% of twins or 90% of triplets are born prematurely. Maternal health conditions, so something like preeclampsia, which is a high blood pressure during pregnancy, can also lead to preterm delivery for the safety of both mother and baby. Infections as well, such as urinary tract infections, vaginal infections, or those affecting the amniotic fluid, can trigger early labor as well. Diabetes, if it's uncontrolled during pregnancy, may also increase the risk of preterm birth. We call something PPROM, which is the preterm premature rupture of membranes. Early rupture of the amniotic sac can also lead to preterm birth, which is often associated with infection or physical stress. Also, problems with the placenta, which is conditions like placental abruption, where the placenta detaches from the uterine wall, can also result in premature delivery. I'm just giving you the different, complications or different conditions that can lead to a preterm birth. Maternal lifestyle factors, something like smoking. Women who smoke during pregnancy have a significantly increased risk of premature delivery. Also, substance misuse, alcohol, drugs such as cocaine can also raise the likelihood of premature birth. Poor nutrition, lack of adequate nutrition and essential vitamins, example, folic acid, during pregnancy can contribute to preterm birth. Not forgetting stress and trauma. High levels of physical and emotional stress or trauma, for example, domestic violence or accidents, can also lead to premature labor. And if you're a woman who's already had a previous preterm birth, you also have a likelihood or a higher chance of having a premature birth because of your history, your previous history. Cervical and uterine abnormalities, which it looks more on the structural issues with the cervix or uterus, can also contribute to preterm labor. So let's go back to statistics. All right. So in the world globally, there's 15 million babies that are born prematurely every year, and around 1 million don't survive. Some of the countries that have higher risk of premature births are India, Pakistan, Nigeria. There's China, United States. And when we look at the UK statistics, approximately 60,000 babies are born premature or preterm each year in the UK, accounting for about 7 to 8% of live births. The survival rates in the UK, with advances in neonatal care, survival rates for the premature babies have improved significantly. So babies born after 28 weeks of gestation now have a survival rate of 90%. However, extremely premature babies born before 24 weeks have a much lower survival rate of around 10 to 35%. So the health impacts on premature birth is a leading cause of neonatal death and long-term health issues like cerebral palsy, respiratory issues, and developmental delays. The prevention of premature birth often involves addressing risk factors like smoking, providing proper antenatal care and treating infections early during pregnancy. So if you are here and you are hearing me today, raising awareness of prematurity during this month. I know November it's Prematurity and Awareness Month, but it should be a year-long thing. Go ahead and reach out to any mother or anyone that has had a premature birth and, provide an encouraging word for them, because it's not easy having a preterm baby. Also, healthcare professionals are there to support you. If you identify yourself to be having all these risk factors, make sure that you are in contact with your healthcare provider. Do not miss your antenatal care at all. Make sure that you're taking into consideration and you're making it a point as of importance for you to carry on receiving the antenatal care, so that the healthcare professionals are there to support you during this journey for safety or a safe birth. So have a blessed day, and I will come your way again. Remember, it's Prematurity Awareness Month. So all this month is going to be about prematurity. Go in the comment section if you've had anyone in your family, a friend, or even a neighbor who's had preterm birth. Let's hear their stories. All right. Bye. It's Mary Dwase. Enjoy your day.